Have you ever felt your heart race for no reason? Your chest tightens, your breath feels shallow, and your thoughts spiral out of control. Maybe it happens at night when you're lying in bed, staring at the ceiling, unable to stop worrying about things that might never happen. Or maybe it hits you in the middle of the day during a meeting at the grocery store or while driving home. This is anxiety. And if this feels familiar, you're not alone. Today, we're going to talk about one man's journey. A man who, like so many others, was tired of living in fear, tired of feeling trapped by something invisible but very real. His name is Alex. Alex was a regular guy. He had a good job, a loving family, and friends who cared about him. But beneath the surface, Alex was struggling. It started small, an occasional feeling of unease, a skipped heartbeat when things got stressful. But over time the anxiety grew. His stomach would churn at the thought of work. Social gatherings became exhausting. He snapped at his loved ones over small things. His mood darkened, and soon Alex started pulling away from the people he loved most. One day, after yet another sleepless night, Alex decided to make a change. He picked up his phone, called his doctor, and said 5 words that would change his life. "I think I need help." And that's where Alex's healing began. First, let's talk about something important. Anxiety is not your fault. It's not a weakness, and it's not something you can just snap out of. Anxiety is a medical condition, just like diabetes or high blood pressure, and it's treatable. Anxiety can come in many forms. Some people, like Alex, might struggle with generalized anxiety disorder, a constant state of worry, tension, and unease that hangs over them like a cloud. Others might experience panic attacks, sudden, intense surges of fear that can feel like a heart attack, complete with chest pain, shortness of breath, and dizziness. While both conditions share similarities, their treatments can differ slightly. For generalized anxiety disorder, the gold standard treatments are usually medications called selective serotonin reuptake inhibitors, like sertraline or escitalopram. These medications work by balancing chemicals in your brain, and here's the key, you need patience. SSRIs often take 4 to 6 weeks to start showing results. They're not an instant fix, but over time they can significantly reduce anxiety symptoms. For panic attacks, medications like benzodiazepines, such as lorazepam or alprazolam, can provide quick relief during an acute episode. However, they're not meant for long-term daily use due to the risk of dependency. Instead, they're like a fire extinguisher. They're for emergencies, not everyday stress. But medication is just one piece of the puzzle. Alex's doctor also recommended therapy, specifically cognitive behavioral therapy. It's a proven approach where you learn to identify anxious thoughts, challenge them, and replace them with healthier patterns. It's not about avoiding anxiety. It's about facing it with the right tools. Alex also started making small but meaningful changes in his daily routine. He started exercising a few times a week, even if it was just a walk around the block. He improved his sleep habits by setting a consistent bedtime and turning off screens before bed. He began practicing mindfulness and deep breathing exercises, simple techniques that grounded him when anxiety started to creep in. And perhaps most importantly, Alex began to talk about his struggles openly. With his doctor, with his therapist, and eventually with his family and friends. And what he discovered was no one judged him. In fact, many people said, "I've felt that way too." Here's the thing about anxiety. It thrives in silence. It grows when you hide it, when you pretend everything's fine while you're screaming on the inside. But when you speak up, when you ask for help, anxiety starts to lose its power. If you're listening to this and thinking, "That's me, I feel like Alex, I'm struggling too," know this, there is no shame in asking for help. Anxiety can disrupt your life. It can affect your work, your relationships, your health. But with the right support, treatment, and a little patience, it's something you can overcome. Alex's story isn't unique, but it's powerful. He's proof that anxiety doesn't have to define you, that bad days don't mean a bad life, and that healing, while not always easy, is always worth it. So if you're feeling overwhelmed, if you're tired of fighting this battle alone, take that first step. Talk to your doctor, reach out to a friend, start the conversation, because anxiety doesn't get the final word. You do. Thank you for listening. If this story resonated with you, share it with someone who might need to hear it. And remember, healing isn't a straight line, it's a journey. Be kind to yourself, take it one day at a time, and know that you're not alone. And as always, take care of yourself. You deserve it. Before we wrap up, here's an important reminder. This podcast is for informational and inspirational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. If you're struggling with anxiety or any mental health concern, please reach out to a qualified healthcare provider or mental health professional. You deserve care, support, and understanding. And now, one last thought for you. Healing isn't about being perfect, it's about showing up for yourself, even on the hard days. It's about taking one step, no matter how small, and then taking another. It's about recognizing your worth, your strength, and your ability to grow beyond the shadows of fear. So take a deep breath, stand tall, and remind yourself you are capable, you are resilient, and you are worthy of peace and happiness. Thank you for being here with us today. Take care, be kind to yourself, and remember, you're never walking this path alone.